What? Are you a good girl? The lily cam is on. You can pose. Maybe we need a little fan. A diva. She wasn't ready to get on the set until she was called to the set. I was in my dressing room. All right, Miss Lil.
We're rolling.
Okay. Happy Friday. Oops. Happy Friday, Baylor College of Medicine and friends of Baylor. I'm so committed to wearing my mask, I forgot to take it off. Well, lots to talk about. Lots to talk about today. So the U.S. Open is going on, and it's interesting that so far the hot spots on the Western world are Serbia and the U.K. They're still the only people left in the U.S. Open. So we'll see. Mongolia, Georgia, not the Georgia over there, but Georgia near Russia is still hot. Malaysia is still hot. Botswana and Suriname. So not a lot changed in the world in terms of hot spots, but the United States remains leading the way. Some positive, maybe positive news is if you look at the cases in the United States, they're beginning to plateau. It's really hard to know. We unfortunately are still around 150,000 new cases a day and nearly 1,500 deaths a day. So we're not doing that well. And we have only 53% of the population fully vaccinated. Now, it's true that 82% of those that are over 65 are vaccinated, but we still have a large swath of the population that is susceptible to infection. And that's going to continue to drive the pandemic and the epidemic in the country. What's really fascinating, if you look at the hotspots map, Michigan and Wisconsin, Minnesota are actually really kind of low, and the Northeast is very, very low. But what's happening now is the hotspots are moving from the Southeast into the Midwest. So Tennessee, Kentucky are really, really bad, and Texas not doing so well. South Carolina is averaging more than 5,400 cases per day, and that's the highest rate in recent memory. And their hospitalizations in that state have never been higher. So they're in trouble. And even though cases are beginning to finally come down in Florida, they have more than 15,000 patients hospitalized, and their hospital systems are really overrun. And the CDC risk level, that's the number of cases, the density of people who are infected. Green means it's safe to go there. There's officially no green in the United States. Even my friends in Custer County, where there's one person per square mile, they've got a few cases. I didn't do it when I went to visit, I swear. I'm negative, so I'm not sure who did it. But there's officially no green in the United States. Texas, we're peaking. I'm a little disappointed in our state. We're not doing as well. In fact, we have a lot of counties now that are hot spots. Of course, friends in Dimmitt County, they're still hot, but a lot of new places are getting to be hot in Texas. And we're seeing a surge in cases in Texas, which is really a stress on the system. And in the Texas Medical Center, I think we're finally plateauing, but it's at a very, very high rate. We're running, last week was over 4,000 cases a day and over 350 admissions to hospitals a day. So that's really, that's a big stress on our hospital systems. You can see it's beginning to plateau, but, a plateau at a peak is not good. It's not until we're in the valley that we're safe. So right now we got lots to go on, lot more work to do. So, I'm always amazed at our fellow human beings because some policymakers make policies and they're almost like experiments. I'm a scientist. I try to design an experiment, but policymakers are making stuff up and they're designing their own biological experiments. So, we rely on modelers a lot, people who take mathematical models to project what's going to happen in the future, and they take all the data they can, and they use, traveling rate, how much virus is in the community, how many people are wearing masks, and try to project what's going to happen. And as you know, we have used a lot of the projections from the Institute for Health Metrics and Evaluation that's in University of Washington. And so I've shown you these before, but the projections are beginning to change, and that's why I thought it'd be interesting to see. Right now, if you look at their worst projection, it goes up. It continues to rise, a little hump that continues to go up. And that assumes that 100% of vaccinated individuals stop wearing masks, mobility increases to pre-COVID range, And that's what happens. If in that case you see this rise that looks like a shoulder. What they're projecting now, based on the current vaccine numbers and the use of masks about the same, is we will be living with this virus for quite a long time, which is kind of depressing, but it's looking more and more like it's going to be endemic for the next several years. But I want to get back to policy experiments. So our friends in the United Kingdom, God love them, Boris Johnson announced Freedom Day. I don't know if you recall, but July 19th was Freedom Day. And I've been trying to figure out that weird thing with UK where they had this giant spike with the Delta virus, then it came down and started going up. Well, that is exactly 2 weeks after Freedom Day, that rise. And let me just go back and show what happened at IHME, the projections. So they projected it. The United Kingdom decided to try the experiment. The experiment failed. So I don't know. So that's an example of bad policy. I'm simply going to say it. That's bad policy. Declaring freedom from a virus that isn't listening to it. But wait, there's other examples. Remember the Japanese super spreader event known as the Olympics? Well, I put a couple of little arrows here. The Olympics took place between July 23rd and August 8th. And then 2 weeks after that, let's see what happened. So check this out. This is at the beginning of the Olympics, not too bad. This is 2 weeks after the Olympics begin. You can see this dramatic surge. 2 weeks after the Olympics end, begins to decline. So that experiment, the experiment that was done by policy was, let's have the Olympics and see what happens in the middle of a global pandemic. Well, you may have heard Prime Minister Suga has resigned, in part because of that experiment didn't go so well. Well, we do our own. The Sturgis bike rally. Let's not forget Sturgis, South Dakota. Before the bike rally, there were 657 active cases. The rally attracted 700,000 people to that community between August 6th and August 15th. 2 weeks after the rally, they went from 657 cases to 3,655 cases, an increase in 456%. Before the rally, they were test positive, were about 6%. After the rally, South Dakota went to 38.8%. I mean, let's have a rally. Nothing bad will happen. I mean, I don't get it. I mean, people keep making things up like, let's ignore it, and the virus is just the virus. Anyway, as you probably know, Kid Rock performed at the Sturgis rally, and half the band was infected. And of course, he was scheduled to come to Texas and do a bunch of concerts. Had to cancel them all. So anyway, since our behaviors aren't working, the only chance we have is vaccine our way out. Of course, or people are going to get infected, and that's kind of, what's happening. We're either going to get enough people vaccinated, and the rest of the folks are going to get infected, where this begins to fall. So one of the concerns, let's talk about the vaccinations concern, is it really safe? Well, there's more and more reporting that it's perfectly safe. There was a very large study published in the New England Journal from Israel. They took the entire country. They had 900,000 people in the control group and 900,000 people were vaccinated, and they looked at complications, whether it was myocarditis or anything else, and they were exactly the same. In fact, they were less often in the vaccinated group than in the control group. And so what they concluded was, at least for the Pfizer vaccine, it was perfectly safe. And then there's a lot of efficacy data. We now know they're safe. Are they effective? Well, there's more data from the CDC. While it's declining a little bit in its protection, the vaccines are still very effective against symptomatic disease. And under the age of 75, vaccines are 95% effective at preventing hospitalizations. Over the age of 75, they're still 80% protective. And so, this slight fall is the reason why people are beginning to talk about boosters, but they're still incredibly effective. Now, here's where I have to apologize to my sister. Because last week or 2 weeks ago, she had asked whether or not the booster was going to be the same. And I kind of said, of course it's the same. Well, in fact, now I think about it, what we really want for boosters is some, a booster against one of the variants or some of the variants, or a trivalent against multiple variants. There's studies ongoing, but we don't have those yet. So right now the booster is exactly the same. But I'm a little bit concerned because everyone is talking so much about boosters. They're all afraid Delta's going to kill us, even though we're vaccinated, and that's not true. And part of the concern that people are voicing right now is based on that CDC report in Provincetown, Massachusetts, where a bunch of people who were vaccinated still got symptomatic, but the symptoms were mild. And the thing that scared everybody was the viral burden in the nasopharynx and the nose was as high as people who weren't vaccinated. And that has been distorted, I think, in the press a lot, and it's very misleading to people. Because the being vaccinated provides a giant wall of protection from the virus going from your nose to in your bloodstream. And it really is an effective barrier to prevent the virus from getting into your bloodstream and causing serious illness. So even in Provincetown, no one really got very ill from it. And when people do have breakthrough infections, they're having mostly very mild infections. Well, and there's a lot of data from Utah, Washington, and Virginia. They actually follow infections according to whether or not people are vaccinated or not. And they've been estimating that only 1 in 5,000 vaccinated citizens of their states are getting positive compared to the control group. So it's very, very rare. And of course, it's going to be higher in the Southeast where the prevalence of the disease is higher, and it's going to be lower, closer to 1 in 10,000 in the Northeast. So it's really, really, very, very safe. You're much more likely to be infected by SARS if you're unvaccinated. And if you look at the hospitalizations, 90% of hospitalizations for COVID are in people who are unvaccinated. 95% of the people in intensive care units who are with COVID are people who are unvaccinated. And if you look at the data from Israel, even those that did have breakthrough infections and got sick who were vaccinated were people who were immunocompromised or over the age of 80. So, it's incredibly effective. There's one other thing that's been circulating around that bothers me. I've got a lot of friends calling, shouldn't I get Moderna because Moderna is better than Pfizer, the Pfizer thing. And that was based on one paper. But let me show you the paper because I just don't think it's really relevant. They took about 1,700 healthcare workers in Belgium. They gave them either 2 doses of Moderna, 2 doses of Pfizer, and then they tested their antibody levels 2 weeks after they'd completed it. And about 20% of the people they took had vaccinated with Moderna had actually been infected before, and 13% in Pfizer had been infected before. And this was the data that shows how much more effective Moderna was versus Pfizer. These are violent plus. They're virtually the same. It's a little bit lower in each case, but not enough to be biologically relevant. So I think then all of a sudden this is blown out of proportion in the press that Moderna is so much more effective than Pfizer. It's not. They're about the same. So let's turn to the rest of the myths that I'm dealing with every day. Wearing masks in school. Well, we now know that teachers can transmit virus to kids if they're not wearing a mask. So there was a California elementary school teacher who had a bunch of kids in her classroom and took off her mask because she wanted to read aloud. Now, she was symptomatic. She shouldn't have gone to school. But on May 19th, she was not vaccinated, and she didn't feel very well, but as she wanted to take care of her kids, she went there, she read them a story, and by the time she learned she was positive, half the class was infected. So 24 kids were infected. So you can transmit from the teacher to the students if the teacher's not wearing a mask and is infected. But wait, it goes both ways. Students can infect everyone too. So in Israel, there was a group of students that ended up closing an entire school because 2 students were symptomatic, and because it was hot, they decided to let kids not wear their masks, and that produced 153 infections of students, and 25 staff members were infected. They had to close the school. So sick kids who are not wearing masks can transmit to other students and faculty, and teachers who are not vaccinated, not wearing masks, can transmit the other way. So that's why you need to get vaccinated, and in classrooms you have to wear masks. Now, there's been a couple of projection models that were published the last week. One that's in MDRX that looked at K through 12 schools And this is just a projection looking at it's like a model, looking at the number of the current level of virus and the likelihood of susceptibility in kids. And they, without masking, they did a model that looked like 75% of susceptible students would be infected within 3 months. With masking, that dropped down to 25 to 50%. And then with masking and testing and cohorting, they thought they could get it down to 13%. So there's a good example of a model, at least, that predicts that wearing masks are very helpful. Our own Chris Amos, who's the director of the Institute for Clinical Translational Research, did a similar model, and he looked at, assuming the current infection rates, that kids would likely, most of the kids would likely get infected if they weren't wearing masks. But the most important thing was the level of virus in the community. So if you look at, if the virus level dropped to 25% of what it is now, kids could almost get away without masking. So the problem is that there's so much virus in the community right now, masks are really required to protect in the schools. And the point that he was making, and I think is a really important one, is there's high variability. You've seen those pictures I show at the state of Texas and all the different counties. There's some communities that have very high viral burdens. They all should be wearing masks. There are other counties that don't have a high viral burden, and they can probably get away with different rules. So that's the importance of why local school districts need to have the flexibility to make policy in their own classes based on the level of virus in their community. And there's a lot of other examples for that. So this is studies from the United States and other parts of the country. In a county that had low viral burdens, there were a bunch of investigators that looked at hospitalizations based on in-person learning and not in-person learning. And there was no difference when viral burden was very low in the community. When viral burden was high in the community, there were huge outbreaks, and that led to hospitalizations. So it's very much dependent upon the level in the community. Remember, the school is just a part of the community and represents the community. But you can protect kids within schools by masking, physical distancing, and practicing good public health. There was a national surveillance study from the United Kingdom that showed the community-wide infection rate rose by just 5 cases per 100,000 in the population. It would increase the risk of an outbreak in schools by 70%. So that just, again, shows you, and that was real data based on the data from that they had in the United Kingdom. And there are other studies looking from Australia, Michigan, and Washington State. When community transmission is low in those areas, transmission is low in the schools. When it's high in those areas, the only way to really protect the kids is to wear masks and do physical distancing. So let's talk about what's going on with the kids these days. The hospitalizations for kids have really soared over the summer. Hospitalization rates for children have increased nearly 5-fold over the summer. Vaccinations have made a huge difference in adolescents. During that summer wave, the hospitalization rate was 10 times higher in unvaccinated adolescents versus vaccinated adolescents. So vaccines are working for the pediatric population as well. We can't wait till we get them under 12. And so, there's a lot of concern about new variants of concern. There's a new one that's been identified in South Africa. The reason this is being watched closely is it seems to be one that mutates a lot. It has a higher number of mutations, and some are considered possibly to impact our ability for the vaccines to work, but it's not spread wide, so we really don't know yet. And of course, there's the Mu variant, in case you want to join the fraternity Alpha Delta Mu. That Mu variant is wide in Colombia. It's really 30% of the population of Colombia has the Mu variant. It's in 40 different countries, but it doesn't seem to be out-competing Delta. Delta seems to be still the most infectious. And so we're watching Mu. It's not really, all that. It's not taking over, let's put it that way. We'll watch and see what happens with the Mu variant. And of course, ivermectin, which has not been approved for use for the treatment of COVID, has now, there's a bunch of reports for poisonings. The CDC has gotten a number of reports of people not knowing what dose to use because it shouldn't be used at all. But anyway, this is inevitable, unfortunately, people using drugs off-label that are not effective, and there are going to be poisonings. So I'd like to end today because it is the 9/11 coming up. It was a real tragedy in our country, obviously. I happened to be in New York City at the time. And we have set up a memorial to really honor the 2,977 victims who died on 9/11, and we have flags set up for each of the victims. I want to thank our volunteers who went out of their way to set that up. Also, like a little shout out to New York City, which took a huge hit. It took a long time to recover from that, and the city really has recovered from that. And so, shout out to them. And also, on the positive side, Ray Martin, our Paralympian, came back with 2 silvers and a gold and escaped, I think, without being infected. So we're really excited. So anyway, have a wonderful weekend, and I can't wait to see you next week.
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we walked, were so gallantly streaming, and the rocket's red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does that